Our next speaker, Mr. Greig Smith, is the Registrar of the Office of the Children's Registry. And this is the agency responsible for receiving reports of child abuse. Mr. Smith was a former team leader at the Child Development Agency Westmoreland office, and he has over 16 years experience of working with children. He worked as a children's officer and team leader for the CDA for 6 years, before which he worked as a teacher and a guidance counselor. So, Mr. Smith, we welcome you. Please come forward. In the meantime, I'm going to ask Mr. Reverend Devil James Bell to come on down to the podium, because we're going to follow straight after. Thank you.
Good afternoon, ladies and gentlemen. As the tagline, or the new thrust by the Ministry of Education, Youth and Information, our children JA, hashtag our children JA, and we want to really, for this Child Month, to see how best as possible we can improve how the care and protection of the children are handled in Jamaica. And so the Office of the Children's Registry, in which I lead, will try our endeavor best to ensure that the care and protection of our children is within our scope and minds at all times. Now, the Office of the Children's Registry, which most of us would have heard of, is a central repository responsible to receive, record, and assess all cases of child abuse in Jamaica. And most recently, probably 3 years ago to be exact, we got an additional mandate, March 1, 2013, to be responsible for the administration of the Ananda alert system in Jamaica. And so what we have seen over the past 9 years, as the registry will celebrate 10 years of being in existence, January 2017, that we would have seen what we would have seen over the duration is increase in the number of reports that we have received. There's no data, there has been no research thus far to indicate whether this trend is as a result of more children being abused, or more persons are aware of the reporting mechanism, the rules and function dealing with children, and how is it that they can reach the Office of the Children's Registry. So currently now we are hosted, or we are managed by the Ministry of Education, Youth and Information. Now, we're pleased that over the last 5 years, the team has thought it necessary to see how best we can reach our children. In 2011, when I took over, and Monday to be exact, makes it 5 years since I'm at the OCR. And so we expand our reach, and expanding our reach, we sought to partner with the Child Development Agency. And so we have instituted offices within the CDA. And why we have gone that route was, one, to ensure that once a report comes in that would need immediate attention, which I must say the Office of the Children's Registry is not responsible for investigating cases of child abuse. And so immediately there would have been action by the registration officer, and then submitted to the CD, who is exactly in the same location for immediate attention. So we have expanded our reach, And we're now in Westmoreland, which serves the western region of the CDA, St. James, Hanover, Westmoreland, and Trelawney. For all those parishes, those reports are processed in Westmoreland. We then move to St. Anne, in which we have a registration office there at the CDA again, which is responsible for the reports done in St. Anne. And St. Mary now have an office in St. Mary that is responsible for St. Mary and Portland. The Kingston Central Office is responsible for St. Catherine, Kingston, St. Andrew, and St. Thomas. And then we'll go north, we have an office in Manchester that is responsible for Manchester, Clarendon, and St. Elizabeth. But what are some of our main roles? That we receive information about children who are abandoned, neglected, physical, sexually abused, emotionally abused, those in need of care and protection, those who display behavioral problem. And as I mentioned before, the Ananda alert system that we are now responsible in terms of coordinating our efforts with all stakeholders, and our major stakeholder will have to be the police, who would be responsible for the investigating of these cases. Now what we do, we assess, record, and refer all these reports, as I mentioned, to the Child Development Agency. Section 6 of Section 1 clearly outlines a list of individuals who are considered prescribed persons. And those are individuals by the virtue of their duty who would have interactions with children, and those also would have been employed by the state, example, police, teachers, guidance counselors, nurses, myself, social workers. And those reports, if for persons who would have seen, based on information collected, would have violated the rights of the child, then those reports would have been sent to the children's advocate for investigation. The aspect relating to the child is also sent to the Child Development Agency, who would then assess and determine what course of action to take. For us, we define child abuse as any act or failure to act on the part of the parent, caretaker, or anyone at all which results in death, serious physical, emotional harm, sexual abuse, or exploitation. And we have 6 broad categories in which, when we speak of child abuse, we're talking about child labor. And itself, when in child labor, the law clearly stipulates that no child under the age of 13 in Jamaica should be employed and working. Children between 13 and 15 can be employed, but to do light work. And as always, the example I would share is a child who attends a school on 2 shifts. And a child leaves morning shift and is able to be employed at a supermarket to pack bags. So once every between 13 and 15, you can be employed. It must be noted that children should not be employed in nightclubs, bars, massage parlors, and children should not be exposed to work that will affect their health and education. Child trafficking itself, we really know what that is, and we're talking about the recruitment, transportation, harboring, and the exploitation of our children for various means, whether labor or sex trade. Neglect is a serious disregard of children's supervision. And out of the 56,000 reports that the OCR would have collected since 2007, more than 28,000 reports are for those children who are neglected. And so one, we need to define who is a child and always have that within the forefront of us, that a child is anyone under the age of 18. And so even if you're going to leave your 16-year-old child to supervise the 8-year-old one, that constitutes neglect. Because in fact, you're leaving 2 children unsupervised by a responsible adult. Sexual abuse, again, is any touching, fondling of the private area. And we're talking about, as the Sexual Offences Act of 2009, Section 10 speaks, that any child in Jamaica, once they attain the age of 16, they can engage in sexual activity without parents' consent. And so the Act also speaks about sexual grooming. Because once you even send at least 2 text messages to a child, and we have those text messages, you can take those text messages to the Soka nearest police station and make a report. And once those text messages do go in the line of coercing that child in some sexual manner, that person can be charged. Emotional abuse, again, it's simple things that we say to our children. You're worthless, good for nothing, and we describe them in all manner. Which sometimes we can recall a few years ago, or probably 2 or 3, where we had a spate of suicide in Jamaica. Because the things that we say, and what we have seen, is that even our prescribed individuals, such as teachers, are really some of the ones who are describing and emotionally abusing some of the children. But if we look quickly on the board, we can see the span in terms of the data. 455 reports collected in 2007, and we can go all the way to 2014, that we would have seen 11,749 reports. And let me say, ladies and gentlemen, these are only reports that are made to the registry. There are a lot more reports that we can't account for. And the data and the research that was done and sponsored by UNICEF in 2013 clearly outlines that only 1 in every 10 Jamaicans willing to make a report to the registry. So we have a serious issue about the informer to dead culture. How is it that the OCR itself will have to reposition itself in society to ensure that we educate the public that once you make a report, it is confidential, that you can trust the system to make a report? So we spoke about this, and when we look, the OCR UNICEF commissioned knowledge, attitude and practices survey, as I said, children 17, we looked at children 10 to 17, and we looked at the institutional professionals. 3, we looked at the public at large, persons over 18. The awareness of the forms of abuse, and you're talking about professionals, 100% that they were aware. Children, 95% in terms of the data population. Adults in general, 95%. Now, when we look at the data in terms of those persons who have experienced abuse, professionals, 88% of those professionals say that they were abused. Children, 82%, and adults, 53%. But in terms of reporting, adults, professionals, 76%, children, 30%, and adults, 11%. And so we have a serious problem here, that even our own professionals, as listed under Section 6, will know about the abuse, but will not willingly come forward to make that report to help the children or help the child. But we can go quickly to the Ananda alert system, because that is another sore point in which we will have to address it robustly and effectively to deal with the number of children who are going missing yearly. The Ananda alert system replaced the red alert as a system responsible for safe and speedy recovery of children and caregivers who are unable to locate them. We're currently now working with the High Command of the Jamaica Constabulary Force, because we have seen the attitude of some of the police officers at various police stations. When a child goes missing and would go to the police station, the police said, wait until the child comes, or you have to wait 24 hours. So we're now addressing their EMT meeting at the High Command at the various divisions, because that's a serious issue. A parent would also go to the police station to make a report about the child who have gone missing, and because the child would have called the parent from a private number, the police will not action that report, because for them, the parent is in contact with the child. And so these are some of the serious issues that we're trying to iron out, work out with this system. But if we look at the data for 2014, and I want to applaud all the stakeholders, because for 2013, 2014, we had a 10% reduction in terms of the number of reports and children who have been reported going back home. In 2014, we recorded the JCF. 1,984 children went missing. 1,776 were recovered. And at the end of that period, we had 201 children still can't be accounted for whether they're back home. And 7 children were reported dead. Now the issue what we found is that a lot of the children at the end of the year, despite you have 201, the possibility lies that they returned home. But the parents is not willing to come forward to say that the child has returned. Because once that happens, especially the female child would have to go through medical examination through the police. Some parents think that they don't want to bring up back that discussion because they fear for the child to run away again. But we now have to wait through our PSAs that is going through Jamaica Information Service. We now have to indicate, which was one situation, that because of the MOU that we had signed with various agencies, including Passport, Immigration and Citizen Agency, that once a child is reported missing, there's a stop order placed at our borders and international airports. And so what we had in one case, child was reported missing and the mother reached the airport and ready because they were ready to travel. And so not until clearance was there to say that that child was removed from the list, then that child could not be able to travel and leave the country. And so we want to rivet through public education that once a child goes missing, you make that report quickly. Once a child returns, that you inform the OCR or the police to indicate that at least we can have that child removed so that the child can have access to regular service as should be. This is our 2014 data. There's still, I think, probably about 2% reduction in the total number we had last year based on reports from the Jamaica Constabulary Force, which is the missing persons monitoring unit that we work closely with. We had 1,941 children reported missing. Again reported recovered 1,739. At the end of the year, we still had 194 and 8 children were reported dead. Now, we want to encourage persons to make reports to the Office of the Children's Registry. We fear about the confidentiality of information, whether your information will be divulged, whether is it that I need to give my name when I make a report. One, I must categorically state that if you wish to make a report to the Office of the Children's Registry, you have that option not to give your name. That's an option for you. The disadvantage, though, not giving your name, is that you will not be able to be given a case ID number. That case ID number that is assigned to that case, you can use it whether to call the OCR to get a general update what action has been done by the CDA or the OCA, or in the fact that if you're a prescribed person and it is reported to the police or the court, if the matter goes before the court that as a guidance counselor you didn't take action, no, that is your evidence to say that you did make a report because you have a case ID number. There are 2 subpoenas for me right now that I have to go to court. Why? Because there's matters before the court that I will now have to give evidence. Whether or not when I search my electronic and hard register, your name did appear in the register for making a report to the registry. And it must be known that Section 6 of Section 4 of the Child Care and Protection Act clearly states that if you have reasonable suspicion that a child has been, is being, or likely to be abused, whether physically, emotionally, sexually, neglected, in need of care and protection, that you must make a report to the Office of the Children's Registry. Failing to make a report, you can be charged 500,000, 6 months imprisonment, or both. Section 7 of the Act also directs to me as a registrar that if I get a report and I fail to send that report for investigation, I commit an offense. And so it shouldn't be within the room that we have the notion, well, I'm not going to send a report because nothing will happen. There's redress. Because if you make a report to the registry and you think that the registry is not acting in the best interest of the child by actioning that report in a timely manner, or you think that the CD again is not acting appropriately in investigating, then you can also go directly to the Office of the Children's Advocate to lodge a complaint, a report. So it should not be there's no excuse to say I don't want to make a report because nothing will happen. We are encouraging you in the best interests of our children that we should make report. The Office of the Children's Registry, in spite we have a number which is 1-888 Protect. We have opened our lines that there are brochures on the outside with multiple numbers. We now even accept please call me. So if persons willing to make a report, there should be no excuse that I don't have any credit. Because persons able to send a please call me at 878-2882. So there's no excuse. It cannot be an excuse again because the registry opens Monday to Fridays from 7 a.m. to 11 p.m. You will ask what about Saturdays? Now the registry since the 22nd of November last year, we have extended our services that we're now open to the public Saturdays and Sundays from 8:30 to 4:30 p.m. So despite those 8 hours might not be adequate, but you have to understand that things will have to be done in an incremental manner, and as we go, we assess how service delivery can be done. So I want to encourage you that together we can make that difference. Let us choose to care and protect, not harm and neglect our children. Let us play our part as citizens. If you know something, you don't have to share it with your neighbor. To say, I'm going to make a report to the registry. You go directly to the registry. So even 11 o'clock, 10:59, 10:30, you're at home. There's somebody at the registry you can call who will take up that phone to answer your call. When regular government offices closes at 5, we have now strengthened our collaboration with the CDA. So if a matter comes in on the weekend and need action in, there's somebody at the CDA who can attend immediately to investigate that matter. And so, despite the challenges, I ask you all to work with us. Work with us to improve the lives of our children. Report those cases that you know, because that's the only way these children can be helped. Because if you don't report it, then we would not have that information to help. So despite our efforts, we're going into school, having school tours, we're going at SDC 2020 cricket all over the island. We're trying to use various means. We're also using social media as a way of reaching out, as Mrs. Gage-Gray mentioned. So we want to encourage you to come on board. Let's partner in the best interest of our children as we seek to move forward this 2016 Child's Month. Healthy children builds a stronger nation, and the only way they can be healthy is for you to take them out of those situations that they're in by making those reports to the Office of the Children's Registry. Thank you.